As everybody is joining, we'll get started in about 3 minutes, 2 minutes actually. At 3:55, we'll get started. All right, everyone, thank you for joining us. This is Chase Gallagher from County Executive Dow Constantine's office. In just a second, I will turn it over to Executive Constantine, who will fire up his video, and then we'll also hear from Dr. Jeff Duchin. So again, our attendees will turn on the video, start the audio connection, and we'll get started in just a second. And Dow, we're just waiting for your video to kick in, and we will turn it over to you.
Yep, just working to get the video turned on. It says I cannot start my video because the host has stopped it. All right.
All right, everybody, hold on just a second. We lost Executive Constantine's connection here. All right, Dow, we're just waiting for you to get back on the video, and we'll get started in just a second. Everybody stand by. We're trying to solve our tech issues here. Just a moment. All right, everyone, we're having technical difficulties on the video.
Yeah.
We're going to move forward just with audio.
That's fine.
Turn it
Thanks,
over to
Chase. I'm going to go ahead. They seem to have turned off my video and aren't able to begin it again, but I'm going to go ahead. This is King County Executive Dow Constantine. I want to thank everyone for joining us today as we outline the next steps for King County in the recovery from COVID-19. It was 3 months ago today that we announced to the region that the first confirmed outbreak in the U.S. of coronavirus had been discovered right here in King County. Now, over those 3 months, more than 540 families in this county have lost mothers and fathers, brothers, sisters, loved ones, too many lives cut short. Over the course of the pandemic, thousands of our fellow Washingtonians have been hospitalized, and more than 20,000 people have tested positive. And early on, we knew that while we wait for a cure, it would be incumbent on all of us to do our part to stop the spread of this scourge. So in those early days, we acted swiftly and decisively to ask people in our community, individuals, businesses, to do their part to stem the tide of the virus, to help flatten the curve. And the King responded. The effort of our community, our hospitals from being, reports have suggested that the efforts of the people of King County to do what became known as socially distance have saved some 10,000 lives to date and prevented countless potential infections. Alongside the toll on human health, our economy suffered a great deal as well. Seemingly overnight, businesses were shuttered, and unfortunately, some of them permanently. And thousands upon thousands of our friends and family members and neighbors have lost their jobs. Make no mistake, price paid by our region has been devastating. And the strength of our region's resolve in defeating the virus has contributed to great progress, reducing infection and slowing the spread, so that today we are able to make a big step toward recovery. Now, just a short while ago, we listened as Governor Inslee announced the next steps in the Safe Start recovery plan for the state, which included a variety of opportunities for counties, flexibility in reopening, the kind of flexibility that reflects the kinds of differences that exist across the state in hitting our key metrics. Now, let me say this, we are on the right track. We haven't quite hit our numbers, and our case counts are still volatile, seeing peaks and valleys along our path to zero. So even with the great progress we've made, we still aren't where we need to be to safely open all the activities as described in the state's phase 2. But the news is still good, because while the numbers are moving, they are moving in the right direction. And Dr. Jeff Duchin, our public health officer, and I are comfortable with reopening some of our businesses and resuming more normal activities in a modified phase 1 plan. So today I am pleased to announce that King County will move to allow more businesses to reopen and more activity, including restaurants with limited outdoor seating, small gatherings with those outside your immediate family, more construction activity to help our economy rebuild and recover, and personal services like hairstylists and barbers. Let me be clear, we are not out of the woods yet. Even with these openings, we still have a long way to go before our economy is anywhere close to where we were 3 months ago. This is a big step in the right direction. We'll be monitoring our progress over the course of 2 weeks. And if our metrics are stable and we are meeting the criteria, then we plan to open up more businesses and activities in a safe manner. But today, because of our region and our state's efforts to be safe and to work together for the health of one another, we can take a big step forward. Our continued vigilance against the virus can help make this a one-way journey from lockdown back to prosperity. And I'm excited that folks will soon be able to support our local businesses by doing simple things like dining at an outdoor restaurant or getting a haircut or shopping for a summer outfit. I would now like to turn it over to King County's local health, public health officer, Dr. Jeff Duchin.
Jeff, we've still got you on mute, unfortunately.
Sorry about that. Can you hear?
Good to go. We've got Executive Constantine back on video for when we come back to him as well.
Perfect. I want to thank Executive Constantine for the summary and express agreement with the ability that our community now has based on the good actions everyone has taken over the last several months to move forward carefully and cautiously. It's very important to recognize the progress that we've made due to the stay-at-home order and the distancing, the mask use, the careful hand hygiene, and the steps that all of us are starting to take as we get back to business for essential workers and now some additional activities. And I think it's important in this context to understand that COVID is not going away in the foreseeable future, that COVID risk remains, and that it's incredibly important for us going forward to understand the risk and how to prevent it so that we can move forward as safely as possible without seeing a rebound in the number of cases that we may experience. And if you remember back to the beginning of March, when we were first seeing about the same number of cases that we're seeing today, ranging from maybe 20 to 40 a day, that outbreak took off in an uncontrollable fashion, and it was only through the incredible work of the residents of King County, leadership of Washington State and King County, that we were able to wrestle this virus down to the level that it was at in March. And those types of efforts must continue in order for us to move forward safely. We need to continue to remember to be safe at home whenever possible, to avoid unnecessary interactions, to understand that in our social, recreational, work, and business lives, we're going to need to reconfigure how we do things, because this virus is not going away and almost all of us remain susceptible. So although it's great that we've come down to what we now see as a manageable level of new cases, clearly we would like to see fewer, and we would like to avoid many more. And in order for that to happen, we're all going to have to work very hard to understand the risks and how to reduce them. So with that, I'm going to turn it back to Executive Constantine and look forward to taking questions.
And before Dow jumps in, he'll have to unmute himself.
Yep.
And just a note for our media attendees, if you use the hand raise question or function, we can go to you and you can ask your question. I'll hit the button to open it up, and then you can jump in. So our first question is from Deborah Horne, who is now unmuted.
Okay, thank you. Am I unmuted? Yes.
You are.
I am. Great. Well, I'll ask the executive this question. Given what Dr. Duchin has said, with us still having to manage the risk and all of that, how confident are you that we can do this and have the numbers continue to drop down as we open up the King County and just the society in general? As we open up the society, can we do that? Keep the numbers down and return to some semblance of normalcy?
Well, Deborah, thank you for the question. I think this is really the central issue. I mean, clearly, if we all just hid in our homes forever, we would have a significant impact on reducing the virus, but that is not a viable plan. So here in King County, we have managed to knock this down to the levels where we believe we can shift from this broad, blunt instrument of the stay-at-home order to the specific contact tracing, paired with the vigilance of every resident in making sure they're wearing a face mask, washing their hands, avoiding unnecessary contacts, never going out when they're ill, and doing all of the other public health recommended measures to try to reduce the chance of infection, even though there's more activity going on. If anywhere in this country, any major metropolitan region is going to be able to succeed at this, at increasing economic and social activity while continuing to reduce the number of infections, it is going to be King County. We showed at the beginning of this that we had the will and the smarts and this amazing population here to take this on collectively, to act in the community's interest and not just in our own self-interest. And that is the same spirit that's going to be required as we move toward more economic activity. I'm pretty confident that we have both the means and the will to do this. We simply have to be focused, have to not let our guard down, have to remember to be careful, and to protect those who are the most vulnerable. And that will remain a central part of our messaging, that we got to look out for those who are most likely to fall gravely ill from this virus.
All right, next question will be from Erica Barnett.
Hi, can you hear me?
Yes.
This question is for the county executive. The CDC just issued new guidance for employers that says that employers should provide incentives for people to drive to work alone instead of taking transit. And I just wanted to get your reaction to that guidance and its potential impact on King County Metro ridership, and to find out if the county is going to be issuing additional guidance on public transit.
Well, thank you, Erica. We've taken a lot of measures to make transit safer and a place where it's less likely for this virus to be spread. We stopped taking fares. We're doing daily sanitation of the vehicles. We limited the number of people who could be on any particular vehicle to promote social distancing. And we're going to continue to add to our measures to make transit safe. But it is not realistic to think that everyone in our region is going to be able to drive alone to work. We simply don't have the road capacity. Many people, in fact, don't have access to an automobile, and that is why transit will continue to be a critical element of our mobility picture here in King County and Central Puget Sound. So the CDC may be giving advice that's sort of broadly applicable across the United States, but in major metropolises like Seattle, that is not a viable option. We are going to be working as well with Sound Transit and with King County's water taxi to provide increased capacity where it's needed, and it will certainly be needed on the West Seattle runs with the bridge out. And transit at this time is probably going to become a bigger part of the mix for those commuting from West Seattle to downtown Seattle and other parts of the region.
All right, our next question is from Hannah Scott from Cairo Radio, who I will relay the question, which is, what are the recommendations for people 60 and over or other high-risk groups if this modified opening is approved?
Dr. Duchin.
Thank you for the question, Hannah. The high-risk groups really are still recommended to take special precautions. Although we are now able to move forward carefully with some additional activities in the community, some additional businesses and workplace activities, some additional social activities, we're still asking the high-risk groups to understand that they remain at high risk, that this virus isn't going away, and that there really isn't in the near future a pre-COVID normal that we can return to. We all need to understand the risk and what we can do personally and as a community to reduce that risk. So for folks who are older or have underlying health conditions that place them at high risk, we continue to advise that they should stay home as much as possible, to avoid as many gatherings with people as possible outside the home. If they do need to go out, of course, use precautions, but have a higher threshold for exposing themselves to others, very similar to what we're currently recommending.
All right, our next question will be from Matt Markovich.
Great. I just have two questions quickly. One, when do you plan to apply for this phase 1.5? And two, the governor put out those guidelines, Dow, that you mentioned, the outdoor seating 50% and things like that. Do you plan to ask for all those parameters, the fitness, the gatherings that the governor has said, or are you going to limit to what you want to have in King County in this phase 1.5?
Well, the modified phase 1 directive that the governor put out includes a whole range of issues and industries, from recreation to construction, manufacturing, to restaurants, for example. And so in phase 2, you would have 50% occupancy inside businesses indoors, like restaurants. The modified phase 1 allows outdoor dining, and we would be applying for the items that are listed under the modified phase 1. Dr. Duchin is, of course, the final authority on what is appropriate in King County in terms of public health. But we've discussed these items, and of course the governor's order is still hot off the press, but we've discussed these items, and I think we agree that they apply appropriately to King County. Is that right, Dr. Duchin?
Unmuting. I think the modified phase 1 is a very reasonable step for us to take at this point. And, I think one thing that's good for us to review here is that over the last couple of weeks, we've seen people starting to increase their activity, people starting to get back to some things that at work and for recreation that they hadn't done previously. And what we're seeing now in terms of case numbers and hospitalizations reflects what happened several weeks ago. And so we do need this time period to wait after activities increased to understand what their impact was. So what we're looking at today in terms of our numbers reflects what happened 3 weeks ago. And we do know that activities have been increasing for the last 3 weeks. And so over the next couple of weeks, we'll see what impact that has on our case rates and our ability to manage outbreaks if they should occur and so on. And that will give us some time to be careful and thoughtful about how we go forward. We would much rather go carefully and not have to go backwards than do too much and risk having outbreaks again that would cause transmission to potentially become uncontrolled. And I encourage you to go back and look at the epidemiological curves that are posted on our dashboards, where you can see the beginning of March with the same number of cases that we're seeing today, that outbreak was about to spiral out of control. And so what we have today is additional tools. We know about social distancing, physical distancing. We know about mask use. We know that we need to limit the size of our gatherings, the time period which we spend together. We know that outdoor, well-ventilated spaces are less risky than indoor, poorly ventilated spaces. All these things will reduce risk. We also now have case and contact investigation activity happening that we didn't have earlier. And we know from our colleagues at the Institute for Disease Modeling that case and contact investigation needs to be very good, very thorough, in order to help us balance a potential increase in the number of cases that we see. We also have increased testing availability over the last couple of weeks. That's very gratifying. And so it's critical to have people understand that when they have mild symptoms that might be COVID, they should come forward and be tested. There's testing capacity now, and that will help us to identify cases early before they spread to others, and have folks isolated safely, identify their contacts so those contacts can stay home and quarantine, and we can facilitate safe quarantine for people who need that. And it's through these actions by individuals and the public health system and the business community that we'll be able to move forward safely. But I do want to reemphasize the importance of getting tested early and of isolating very quickly. And for household members of people who are suspected to have COVID or have COVID, critical importance of those people staying home for 14 days and getting tested quickly. The speed is really going to be the key here in our ability to successfully move forward further than phase 1.5.
All right, our next question will be Chris Daniels from King 5.
Hi, I guess I want to follow up on that question, just the technical aspects of it, because anybody who's hearing this is wondering, hey, does this mean I get to open by Monday the 1st? So how long will it take to actually go through this application process, get it greenlit, and allow these businesses to open? And then second, related to that, for the executive, Constantine, are you looking at any zoning changes, code changes to perhaps allow restaurants to have additional outdoor space in sidewalks or streets?
Dr. Duchin, I don't know if you want to hazard a guess at how long it will take after the June 1st application date to get approval, but because we fit within the criteria outlined in the modified phase 1 portion of the executive's or the governor's order, I believe it should be a reasonably quick process. Dr. Duchin.
Yeah, I would imagine once we get the documentation together, it wouldn't take more than a few days to get a decision from the state Secretary of Health.
And then, Chris, in response to the second part of your question, that is an issue for each local jurisdiction. As you know, we have 39 cities in King County, and then we are the local government for the unincorporated area. And each of those places is responsible for determining where and how much outdoor seating there can be at restaurants. As the executive for the unincorporated area, so essentially the mayor for the unincorporated area, I want very much to make sure that our restaurants have that space outside to be able to provide service and to make money and put people back to work. And I'm sure the mayors, and I had a meeting with the mayors of King County yesterday and discussed this very issue, and there's quite a bit of enthusiasm for making sure that they're able to provide that same opportunity for their restaurants.
And this is Chase, just following up on Chris had a follow-up question of clarifying that means not June 1st.
We would not have approval by June 1st, presumably, because that is the first date on which we can make application to move to this modified phase 1. but I don't expect it to be a prolonged process. I don't think the governor's office would have announced this if they didn't expect to be able to process these and have our businesses up and running in relatively short order.
All right, and just a reminder for our attendees, if you have a question, use the raised hand function. We'll call on you. Next, we will go to Joe O'Sullivan from the Seattle Times. Joe, can you unmute yourself?
Can you hear me?
Yes. We gotcha.
Sorry. So you mentioned barbershops, hairstylists, outdoor dining, some construction. Are you seeking to reopen just those activities or everything that's allowed on the list of phase 1.5?
I believe that we're talking about applying to be able to do all of the things that are on the modified phase 1 or phase 1.5 list. Personal services includes a whole range of services. I just use barbers as an example. But the limitations on that under this 1.5 are that the business can only be occupied at 25% capacity. So it's an attempt to provide some space and reduce the chance of infection. Things like pet grooming are allowed. In-store retail with a small number of people in a retail establishment, and again for a limited period of time, 30 minutes. And I think Dr. Duchin can explain what the role of the time of exposure is, how important it is that you not be in the same space with someone who's potentially infected for a long period of time. But each of these has some logic behind it and is intended, the limitations are intended to minimize the chance of infection while allowing economic activity to continue. Dr. Duchin.
Yeah, thank you, Executive. So the way this virus transmits is through droplets, which come from the nose, mouth, throat, and they can get into the airspace. Small droplets when people speak, when they cough, laugh, sing. And that's one reason why mask use is so important. We need to throw everything that we have at this virus right now. And, you might hear some people arguing about studies and, evidence. And we do have evidence that suggests mask use is very important. And if you look at countries that have long histories and experience with mask use, they think that the biggest mistake the US is doing is not requiring more mask use. So that's an example of things that people need to be aware of with respect to risk reduction. The other things that are important are the duration of contact. The shorter that we are in close contact with others, the less the risk. And there's no magic number. I mean, the longer you're around other people, the higher your risk is. Same with ventilation. Outdoors is great, lowest risk possible. As you come indoors and ventilation becomes less, the risk will go up. But windows open, good air handling systems that exchange air with the outside frequently, filter air, all of these things will decrease risk. So there are many things that we can do in our built environment that will help us decrease the risk and that we're going to need to pay very careful attention to going forward in workplaces and in other places where people need to gather. These are examples, but the duration of contact, the proximity of contact, the use of masks, these are all critically important considerations, and we need to try and at all times minimize our individual risk and our risk of therefore, without knowing it, before we develop symptoms, spreading that virus to others, taking it home, and perhaps exposing people who are at high risk for very serious illness.
All right, and we have one final question from CE Bick, who may be having some microphone issues. So we'll see if we can hop on there.
Hi, yes, can you hear me?
Yes.
All right, super. Thank you so much. All right, so I have a few questions. Shall I ask them all at once or shall I ask them one at a time?
Well, why don't you ask the first one first?
All right, that sounds good. All right. So this is for Public Health Officer Duchin. Given that the King County COVID-19 dashboard data shows that the county is still under its target testing capacity and speed, could the number of COVID-19 cases actually be more than 28 per 100,000 people?
Excellent question. So our ability to understand how much COVID is out there is dependent on doing enough testing. And testing has been increasing. So I'm more confident now in the numbers of cases that we have than I have been at any point in the epidemic. If you can see that our ratio, our target ratio of 2% positivity or 50 to 1, we're getting very close to that. So again, these are not magic numbers where you hit them and all of a sudden you've crossed the threshold. These are best estimates from a variety of different sources. So I think my interpretation here is that we've got adequate testing capacity today for the people who are coming forward to be tested. And I think what we need to do is get more people tested to have a better sense of how many infections are out there, particularly going forward. We want people who have mild illness to come forward. We even want household contacts and other close contacts of known COVID cases to be tested if they're asymptomatic. So I think we're close to where we need to be currently for testing. I think it's adequate, and we do understand that we're only identifying one case for every 10 to 13 that are out there. The other important information that we look at, because we know we're not capturing every single case, is the impact on emergency rooms, on hospitalizations and deaths. And we see all of those indicators going down, which tells us that although we're not testing as many people as perhaps our target indicated we were shooting for, we're not seeing indicators that we're missing a lot of cases that are ending up in the ERs, the hospitals, and having serious illness. Everything is trending in the right direction, and all the indicators are reinforcing one another. So for these reasons, I have some confidence that going forward now makes sense, but we still need to do that very carefully, slowly, and recognizing that every day people are doing more and more. So we need to understand over time the implications of those actions that make themselves visible 2 to 3 weeks later, and adjust our course if necessary before things get too far along in the wrong direction.
Okay, thank you. I appreciate that. This kind of actually builds then on that question. This is actually could be either for Executive Constantine or for Public Health Officer Duchin, but I represent a publication in the South End that primarily has a lot of readership from communities of color. So how will you ensure that communities who are most vulnerable to the disease have adequate testing as restrictions are eased? I'm specifically thinking of immigrants and refugees in South King County, many of whom face extra barriers to testing, including a lack of easy, safe transportation. Will you be creating more testing sites that are easily available to them in order to ramp up this testing in the way that you're talking about, without necessarily having to rely on hospitalizations, because these communities don't necessarily go to the hospital right away for various reasons?
Right. So I'll start, and then Jeff, you can talk a little bit about the plans that we have for testing moving forward. This has been a central concern and consideration throughout the last several months, that there's very unequal access to healthcare, to testing, to all of the resources that are required for people to be able to successfully navigate this pandemic. And as we talk about continuing to ramp up testing in King County, Public Health has been doing a great job of incorporating our social justice imperative priority at King County to figure out how we can get testing to people who are least likely to have access right now. And as I looked at the chart yesterday at the places where we're going to try to direct tests, it was very exciting to see how our principles, our beliefs were being realized in the work that you're laying out before us, Dr. Duchin. So could you just speak a little bit about the way in which we're seeking to make sure testing gets to those who may not have access?
Yes, definitely. It's a critical issue. We are looking at the data very hard to understand which communities are having higher rates of disease and then looking at where testing is available. We want to get as much testing in those areas that have higher rates and convenient for people who live in those areas as possible. And if you look at our website now, I think you'll find an increasing number of testing venues in the south part of the county. We're also having mobile testing that will be at various locations in the south part of the county. There will be some more information, I believe, discussed on Monday publicly about new testing opportunities. And we continue to look for ways to bring more tests into those communities and not only bring testing there, but also try and facilitate the ability of people to be tested. And so another activity that is very important to us is to engage community health workers that actually live in the communities that are affected, who know the neighbors, who know what people's challenges are, and could help them best navigate whatever system we have in place to get tested easily. That might involve understanding when a mobile testing site will be available or where the nearest community health center is. And we're working also to try and bring mobile teams to certain populations who really can't get out of their homes. And we also would like to have in-home testing. So you may remember the SCAN study is one where testing is requested on the internet, and a kit is delivered and then picked up. So for certain populations, that's a very good option as well. We've been engaging the community health board coalitions and getting feedback from community members about the challenges that their communities are seeing, and specifically asking them for suggestions about how we can best improve access to everyone that needs it. And we welcome feedback and are constantly working to try and improve this, because as I said, it's quick testing, bringing people in or getting them to attest to someone who's ill as soon as possible, so that that person can be isolated and reduce the risk that they spread to others, is critical. So we are really trying to identify every way that we can to make that happen.
All right, and we'll turn it over to Executive Constantine for final remarks.
Well, thank you, and thanks to everyone for being here today. I want to, again, really credit the people of King County. Everyone stepped up when this started. From the largest corporations to sole proprietors to individual workers, people chipped in. And even though we were the first in the country out of more than 3,200 counties to experience a recognized outbreak of this virus, we fought it and we got ahead of it, and we're going to keep fighting it. But the only way we can do that is if we each individually contribute to the effort. This needs to be a one-way trip for King County, from lockdown back to prosperity. I believe that there will be many places in this country where they approach this in a way that's reckless, and is a way that creates a false choice between health and public health and economic vitality. The two have to go together. In order for us to have sustained economic recovery, we're going to have sustained control of this virus, and that comes down to everybody redoubling their efforts as there's more activity to prevent the spread of the virus, just as we increase the ability to trace contacts, to provide testing, and all the other measures that are needed. I am very confident that we have what it takes to keep this thing under control, to keep a lid on it, even as we build our economy and get people back to work. But it's going to take every one of us contributing to that effort. So please follow the directives, make sure that you are being considerate and being part of the solution. And if we all do our part, we are ultimately going to beat this thing. Thank you all for joining us today, and I look forward to happier days ahead.
Thank you, everyone.